I'm trying to get my friend on here. Mm,
So we're going to grandma's tomorrow?
tomorrow?
Yeah,
Why?
because school's open.
No, because the clinic is closed.
Oh, so we're gonna be home tomorrow?
Mm-hmm.
Okay. Why is the clinic closed?
Because of the weather.
Okay, but I don't think the power's gonna go out. It never snowed like it said it was.
Well, I pray to God it don't. Hopefully you're right.
Well, yeah, because it was supposed to snow last night. It was supposed to start happening this morning.
Show that to people this link during your.
I don't think there's gonna be a freeze, mom.
Hopefully you're right, son. Hmm. Let me see. How do I invite? Let me put my link in the chat. Give me a second, guys. We're going to be talking about surviving your first year as a nurse. Unable to connect. Hopefully today I will be able to see comments because last time I wasn't able to see nobody's comment. Oh, TikTok wants to be janky today. I see that you're on TikTok, but it won't. Oh, there you are. Can kind of hear you. It's a little bit like a echo in the back. That's better. Mm, no. Are you on Facebook too? Okay. Oops. I almost canceled the live.
I might have to take my headphones out if the volume or the sound doesn't get better.
It's kind of okay. It's a little bit better. It's kind of okay. TikTok's been acting kind of janky today. Like, I don't know. I tried to post a video and it didn't even show up. It's good to see you though. You're blonde.
Girl, I made it red. It's the first time I've been like copper red. I had to change things.
Oh, it's red. Okay. I guess on the video it looks blonde.
Yeah, Kill has the ring light and everything set up, so it's a little bright.
Okay, Akil.
I know he's trying to help me out here.
The virtual assistant.
Right.
I need one of those.
No, I think it's good. That's fine. Goodbye, Kill.
Hey.
He said if I'm. But yeah, it's really good to see you. I think the last time I saw you was at graduation, wasn't it?
Yes. Yep.
How was it already?
So that was in May. Yep, that was in May. Well, like what, 6 months ish, 7 months.
Oh yeah. Come on, why is it's not letting me into Facebook?
It's this internet probably.
Probably. My internet has been really spotty here lately.
What's your hospital doing with this freeze? Are they riding out and all that?
Well, I don't know. I'm not allowed to log in because I'm on leave.
Dang, they don't even let you log in.
But yeah, they told me I couldn't even log into my email.
Sheesh.
Typically because the inpatient side is so small compared to all the other hospitals, because at MD Anderson, it's all basically outpatient research is kind of the bulk of us.
Mm-hmm.
So the inpatient team for sure will write out and I know like the ATC, or that's what we call like our infusion centers, they will most likely be open, but everybody else will probably either have like a late start or switch everybody to virtual.
My hospital, they activated their ride out and recovery team, and then they just sent out an email talking about they've canceled it. I'm like, why would y'all cancel it before the worst night? Like, tonight is supposed to get. Yeah, that doesn't make any sense, but whatever. Whatever.
Yeah, I'm just glad they went ahead and canceled school on Friday.
Exactly.
We don't have to worry about that.
Exactly.
And then I kind of giggled because was it Mount Bellevue? They sent out this. They also canceled after our district did, but it was just kind of it was a very sarcastic. What did he say? He said nobody gets mad when you cancel things, but everybody gets mad if you hold off. So we're just going to cancel it. Okay.
Facts though, because I was like, I'm glad they went ahead and did this today and wasn't messing around Sunday night, and we're all waiting to see what's going to happen.
Right. Okay, maybe it's this. I don't think I've ever logged into Facebook on my computer before. Maybe. Oh,
ever?
No, I didn't. thing. It's like sketchy.
If you can't, it's fine because you're logged into TikTok, and then I can just still I can end up saving the live on TikTok. So
okay.
For the replay for everybody. So we'll just get started. Hey everyone. This live is your surviving your first year of nursing, and you're talking to a nurse that has a background in Medsurg and a nurse that has a background in the ICU. So you're gonna get different perspectives. So if you're a nursing student or a new nurse trying to survive your first year, this live is for you. We're having honest conversation about what the first year of nursing really looks like, what we experienced, our thoughts. Um, so whether you're still in school, about to graduate, or already questioning everything, you're not alone. This is a safe space. Any questions you have, please put them in the chat. So we can start by introducing ourselves. My name is Cedra. I call myself the Nurse Bae Coach, and I help nursing students. I tutor nursing students, and I help new nurses survive that transition from school to the bedside, because it can be two totally different worlds. My background, my first specialty was Medsurg. I did that for a few years, then day surgery, then interventional radiology, and now I am in an interventional pain management clinic. So that just lets you know that nursing has many different pathways. If you start something, you don't really know if it's for you, you don't like it, you always have an opportunity to move around somewhere. So don't let that first specialty that you're in discourage you, because there's so many different pathways of nursing.
All right. And I'm Stephanie. My background is ICU. I did ICU majority of my career, and I also did PACU. I did both of those simultaneously for several years, all the way through COVID. And then I got a little burnt out during COVID, so I got some good experience with that. So we can be open and honest about what that's like. So now I am in a clinic. So I work in a doctor's office now. So like Cedra said, this career can take you kind of anywhere you go. I never thought I would be in ICU until I got burnt out, and then I had to step back and reevaluate things, and now and choose something better for work-life balance. So that's where I'm at now.
That's what we call soft life nursing.
Amen.
Yes. So one word that describes your first year of nursing and why.
My one word to describe the first year of ICU nursing, which I feel is a whole different ball game. I would say chaotic. And the reason I would use the word chaotic is because of two reasons. Is because I was a new grad nurse in ICU, so that the environment is just chaotic, but also the level of education I was getting and teaching I was getting, I feel like I was just kind of kicked into it, like, here, let's figure it out. Mm-hmm. And which you did, you either sink or swim sometimes, and I feel like it was just a bunch of overwhelming learning my whole first year.
If I had to describe my first year of nursing in one word, I would use that word: overwhelming. Overwhelming. It felt like, dang, what did I sign up for? what did I sign up for? Like, this is totally not what I expected at all. You don't truly get prepared for what the floor is like in school. School is a totally different world. And then med surg nursing, depending on where you're at, what your ratios are. But where I was at, your standard ratio was 5, 1 to 5. And then a lot of times, because of short staffing, you would end up with 6. So having to take care of that many patients and everything that they require, and prioritizing what comes first, what can wait, and it was just it was overwhelming, I would say. That's my word. Yes.
I feel like that's kind of, when I talk to people, I feel like that's kind of the biggest word I would hear, or the most used word, is overwhelming for your first year.
Absolutely. So, what did you think your first year would be like? What was it actually like?
I feel like when I was in nursing school, I had a false sense of confidence. And I thought I was just going to breeze right into it. And I was going to go in and just say, hey guys, I'm here, I'm ready. And
I'm here.
Yeah, I kind of walked in with that confidence and very quickly got reminded that, no, sit down a little bit. We have some learning to do.
Yeah. I'd say I thought my first year would be hard, but a little more like structured. Like I figured I'd be nervous, but I'll follow these steps, step by step, and eventually it'll click. But it was pretty much like controlled chaos from day one, I would say. I would say. And then I realized very quickly that being a good student doesn't automatically make you like a confident nurse. Like you can be great in school and you get on the floor and it's like, I don't know anything. I thought I knew a lot, but I don't know anything.
Yeah. My very first day by myself, I'll never forget. I tell this story a lot. It was a learning. My very, very first day by myself as a new grad, I clock in and I see a crash cart outside of my assigned room.
Yeah. Like, oh, that one's mine.
Like, okay. And they're like, oh, well, they just did a bronch. It's okay. They just have it out there just in case. And
for a bronch?
For a bronch, yeah.
Okay.
Red flag number 1.
Right.
But we go and I go and do my assessment, and I'm looking on, and then all of a sudden I see the patient. His heart rate goes from like 100 tachy to 40, just perfect rhythm. And I kind of panicked. I remember I panicked, and then I was like, something's not right. His oxygen starts to go down. And then I'm trying to go through all of my nursing school things, and I was like, oh, I think this might be PEA. So I checked, but I'm so nervous. I'm like shaking, and I'm trying to find a pulse, and I can't find a pulse. So I'm like screaming for the nurse next to me, like, can you feel it? Help. And then, yeah, I had to code this person 3 times.
Oh, wow.
And he had a tension pneumothorax, and we had to put in chest tubes and all these things. That's day number 1.
Oh my God.
And I was like, is this what it's going to be like forever?
Yeah.
I almost walked out then and chose a different specialty, but thankfully I stuck with it.
And isn't it like if you're in the ICU, you don't really push the code button because y'all have your own like code team there, right?
We do push the code button, but it doesn't go out system wide.
Okay.
So like, when you're on the floor, you push it, it goes, and they do, like a rapid response or whatever. No, we don't do that. It goes just as centralized to the ICU, and we'll go, and then you'll have a few people stay behind to watch everybody else, but who's available will go and help you.
Gotcha.
Same thing with rapid responses. Like, well, we are the rapid response
team,
so yeah, so that's, we just kind of handle it on our own there.
Got you. Oh, I forgot to tell you guys, fun fact, me and Stephanie went to nursing school together. We graduated together back in 2017 and with our associates. And then crazy enough, we ended up finishing our bachelor's at the same time and graduated from UT Arlington in May 2025. And now, do you plan on going back anymore?
Yeah, I'm looking into it. I am trying to find what school I want to go to. Because what's the problem with me, and I know there's a lot of nurses out there, nursing students that probably have this too. I have ADD, like the OG ADD, So online school is very difficult for me, and that's what took me so long to get my BSN is because it's all online, and that was very difficult for me to navigate and do. So I'm looking for an in-person class or program, and that's very difficult to find. So I did find one, but it's in Austin, so I'd have to drive to Austin every week. But
is UT Health not? Are they not in person?
It's virtual. They're most schools now, like MSN schools, except for the clinical part, is virtual.
Are you trying to do NP?
Yeah.
Okay. Yeah, I'm not sure. I'm pretty sure I will end up going back for my master's. What exactly I want to get it in, that's the part that I'm like going back and forth on. Because at first I was like gung ho, like I'm not doing NP, like no, I'm not doing clinicals ever again in my life. But then I was like, I wonder, like based on what I'm doing, like with business and my career pathway, would it be more beneficial for me to do NP? Because then I started leaning towards informatics, but I'm like, will that help me? I don't know.
Nurse, I thought the same thing. I was looking into informatics, and then she walked me through what she does, and I'm like, I can't do that. I can't. It's all like data, and it's just like trends and kind of all of that stuff. Like it's almost like research.
Like way too tedious.
Yeah, and I was like, no, could never. So I'm thinking about doing the adult gerontology. They have a DNP program where they do both acute and chronic, so you can work inpatient and outpatient.
Okay. Is that double the clinical time?
It is. I think it's DNP, so it's just like a hybrid. Like where you do your MSN and DNP all at the same time.
Oh.
It's like a year longer.
But once you're done, you have both.
You have both, so you're not. My thing, and the reason why I chose nursing to begin with, is because I didn't know what I wanted to do when I grew up, right? So I like to explore different things. I might get bored, and I'm like, hey, I want to go over here and try this or that. And nursing was the one thing that would allow me to do that, where I could go, like how both me and you kind of had several different careers in this one, and like let's say tomorrow I don't want to be in the clinic anymore, I can go back to ICU. I can go back to PACU. I can
have
do
that
all
option.
These things. I can even go do like not virtual, which that is an upcoming thing. I found out. We'll talk about that in a second. The virtual hospitals that they're trying to start.
Oh, okay.
I went to a conference and we were talking heavy on that. Is like the IV, like mobile IVs. I could do that all day.
Yeah.
So it just depends. It's there's so many different avenues that you can do, and that's why I kind of like the adult gerontology is because you can. It's kind of the same open door for if I don't want to be in patient bedside anymore, I can go to the clinic side or vice versa. So there's so many different.
And if you do adult gerontology, you don't have to work with kids. Sounds like.
No, adolescents and up. So I think the youngest I could do would be like 16, but primarily it's 18 and over.
Okay, you're putting a bug in my ear. Which school is this? MSN, DNP at the same time?
Most places have that now. So, but I know Texas Women's have it, the DNP program. I think UT Health has it. What is the other one? The one in Austin is, I believe, the UT Austin.
Okay. I'm going to have to look into it.
They have it in person, yeah.
Okay. All right, girl. So what shocked you the most in your first 90 days, would you say?
First 90 days. what shocked me the most is, that's a great question. Because I was in healthcare before nursing school, so not a lot even then shocked me, but it was how, I guess, family dynamics kind of shocked me the most, honestly. When people would come in when their family is really sick, and just the differences of how people handle things.
Yes.
Was very eye-opening to me on a lot of things. And that actually gave me a lot more compassion for people in my day-to-day, because you just don't know. And just different cultures and different family dynamics, and how people will just really handle bad situations, I think was probably the most shocking to me, honestly.
Yeah, I can imagine, especially in the ICU, and people are so sick, and then the family's always like, do everything you can, and you're looking at the patient like, let this patient go. They are miserable. Like, you're prolonging. Yes, you're prolonging so much pain and agony for this patient. Like, you don't even understand.
It's gotten me to go ahead and me and my husband had very in-depth conversations for very specific scenarios because of what I've witnessed. Like, if this is happening, just let me go. If this is happening, blah 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 blah. So
yes.
yeah.
And fun fact, I know I have like 15 jobs, but fun fact, I just recently got licensed in life insurance. And that's one of the things, like, especially as a nurse, we see so much in our jobs. You see life, you see death, and then it's like a lot of times people don't think about what's going to happen when they die. It's not if you die, it's when you die. You're going to die. So it's like you need to set yourself and your family up for when that happens. So nobody's arguing, nobody's like, I want this, and another person's like, I want that. And you're leaving something behind for your family. In our community, I'm talking about the Black community, we have it bad where we don't think about the after. We're just like, I'm just trying to survive day to day, which, yeah, I mean, it is what it is. But at the same time, like, we have to make it a habit and change the narrative that we have to have fish fries and we have to create GoFundMe's to bury our loved ones, when we can be setting our families up for not having to struggle ever again. But we don't think about that because we think, oh, it's so expensive, when it's really not. Or, oh, that doesn't apply to us, which, no, it does. We need to change that. We need to change. What was that I got from Damon Dillard? Oh, you shared it. What was that quote I got from Damon Dillard? It was, these things ran in my family until they ran into me. You be the change breaker in your family. You be that person that, whatever that generational curse is, it stops here. It stops with me. And I've put it on myself to be that person in my family. And that's why I take on so much. That's why I have so many things I'm doing, because my family, that's not going to happen here. Y'all are going to be set up for the day that I die to not have to worry about anything. And I want that for all of us. Anyway, I don't know how I got on that rant, but there you go.
I was going to say, like, this, we talk about generational wealth. That's never been in my family either. Like, that's not, I wasn't set up. When my dad passed away, it was awful because he had nothing set up. And it was just pure chaos. And I was like, I will not, just even going through that, on that side of it too, it's just like, I don't want anybody to have to struggle or like have to figure it out over me. So now, like, we have everything in line just in case something like that happens, so my kids don't have to worry about that.
Absolutely. Let's see. Is there a skill, or what skill did you think you had but realized you didn't? Or is there a skill you thought you had but you realized you didn't?
A skill that I thought I had that I realized I didn't.
And what skill did you get good at quickly out of survival?
Out of survival. And that is that one. The skill that I have learned is the quickest out of survival is learning how to read the patient and not the monitor.
Yeah.
So when you so you're always taught, in school, treat the patient, these numbers just kind of help you out and blah, 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 blah. But I didn't truly know what that means until I was doing codes every day. And then you start to notice really fast, like things that you'll see on the patient before it shows up on the monitor. And I got really good. I'm still really good about that to this day, even in the clinic side. I've caught a lot of things just from a pulse ox and how the patient was acting. So that was out of pure survival mode. The thing I thought I had and I was confident about, for whatever reason, but I didn't, for whatever reason, in the beginning of my career, I was so scared of medications and giving medications and doing something to a patient that would harm them because of what I've done, as far as like giving too much medication, not giving it at the right time, and all of those things. And I walked in, like I said, I came in as a new grad, super confident, like, yeah, I'm good at, whatever. And then soon, shortly after, thankfully, I've never had any, big events or anything like that. But it was always, and I think that actually made me an even better nurse because I was so paranoid of doing something wrong.
Yeah.
That I double, triple, quadruple check everything, and I asked a million questions to everybody, like, are you sure? Because I was so scared about that.
Absolutely. I want to point out for the nursing students, one thing you said about watching the patient versus the monitor. In school, when you're doing your exams and you see a question that's asking you something like, what would the nurse do? Or what should the nurse do first? If you see any of your answers and their interventions, and one of them is an assessment, you're always going to go with assessment because you have to do that before you do anything. Is assess first, period, point blank. And then, so what skill did I think I had, but quickly realized I didn't, was time management. I thought I was pretty good at that. Like, just go in, get my patients, list what each person needs, my meds, blah, blah, blah. But something's gonna happen, something's gonna throw you off, you're gonna get caught up somewhere else, and your like time management is just like, yeah. I thought I had it down until I became a Medsurg nurse because there's so many different patients. Everybody needs something. Everybody needs something different. Somebody wants pain meds right now. Somebody's got to go to the bathroom. Somebody wants a warm blanket. Bring me something to drink. It's like you're the nurse, you're the housekeeper, you're the waitress, you're everything. So I quickly realized that I had to get my time management together. And then, so that skill that I learned quickly out of survival was that and prioritization. What do I need to do now? What can wait? And then I also got pretty dang good at IVs because um, I worked nights, and so not a lot of people are there. And plus, I didn't want to have to always be going to ask somebody to do it for me. So I got pretty good at that, and then that helped really well for day surgery because I worked pre-op, post-op, and pre-op. You're doing nothing but starting IVs on everybody. Everybody's getting an IV, and nobody wants to. You don't want to be the nurse that always has to go to somebody. Hey, can you do my IV for me? No. So I got really good at that.
Fun fact about that, actually. So, I was a phlebotomist before I was a nurse. All through nursing school, I was a phlebotomist. So I was a designated person. And then when I went to ICU, that's when they stopped having phlebotomists go to the ICUs. And none of the nurses really wanted to do that. So I actually paid for a Vegas trip because I had a jar. I'd be like, you wanted me to draw your blood? Here, give me, Stephanie's Vegas fund is what we call it. And like, you need an IV, you need your blood drawn here, just go put it in Stephanie's Vegas fund.
Nice.
And I would go and draw everybody's blood in the morning and stuff like that.
Hilarious.
We actually went to Vegas off of that.
That is funny.
So
I
she
didn't
did
know
so
that.
bad.
I did not know that y'all had to draw y'all's own labs all the time.
Yeah,
Well,
we had to draw our own labs. Yeah, we had to draw our own labs and like EKGs and all of that. Like
mhm.
they didn't come to our floors anymore. We had to do all of that.
Oh. Well, don't most of the patients in the ICU, they have like PIC lines and central lines and stuff?
You would think, but a lot didn't.
Really? Okay.
Yeah.
I
No,
thought
really,
so.
like our high acuity folks, they would have them for sure, you know. But if we did have some that were either about to transition out or they're just there for overnight observation, given, you know, like a surgery or whatever, they wouldn't have those things. So I'd say at least half the unit didn't have it.
Oh, well, that is surprising for me. I thought most of them did. Okay.
No, trust me, we want most of them to have an art line and pick lines, and that is our dream. But about half of them probably did it.
Okay, so now we get to play Confessions of a Nurse. So we can answer any one of these things or multiple things. So one thing I was scared to admit my first year was a moment I went home and questioned if I chose the right career. Something I struggled with that what you said daily. Something I struggled with that I thought I was the only one experiencing, and a mistake that taught me more than any textbook ever did.
Well, I can answer the mistake one that taught me better than any mistake ever would, and that it will piggyback on my fear of meds. And I was probably, how far along in nursing was I? About, I would say 6 months plus as a nurse. I think it was still within my first year though. We had a patient that we were intubating and his pressures dropped, which is expected. And give 50, I look at the syringe. So I give 50 mgs of phenylephrine. Everything, whatever. So I go out there, we go to scan the meds because it's in we just had it at bedside, so we scanned it afterwards. Well, it was 50 mics, not 50 milligrams. Mics on the other side.
Mm-hmm.
I don't think, and I'm like, what do I do? All of these things. Like I'm trying to put a list together. I'm over here with my, charge nurse. I'm like telling her what happened and blah 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 blah. Longest 3 minutes of my life because you cycle the blood pressure every 3 minutes. Longest 3 minutes of my life, and I'm sweating. I'm like, oh my god, oh my god, oh my god, And then look, the blood pressure 5 cycles is like 120 over 80.
Oh, thank God.
Relief, but whatever. Oh, thank God, everything is fine. But the lesson was when somebody says something, like especially if you're doing it, clarify and repeat back in which that means, because he just says 50 of phenol. 50 what of phenol? Now I ask 50 mics, 50 milligrams, 50 mLs, like 50 what? And that was a very critical lesson for me that really helped me out and saved my butt a lot of times throughout my nursing career after I learned that one. It just took a lot of a lot of anxiety and sweating. That's a lesson that I carry with me through to this day.
For sure. Oh yeah, that's scary.
Yeah.
My confession. So I always wanted to eventually, okay. This isn't really a new nurse confession. This is just a nurse confession in general. So I always wanted to kind of like move up. Like I kind of figured that I would end up moving up in position. But what I didn't realize is that when you move up in position, you're gonna go from liked to not really liked that much. So your nursing friends, the nursing friends that you were like, on the same level with, once you're in a position to where you have to like start telling them what to do or delegating to them, you're gonna find that sometimes attitudes change towards you, and um, you may not have the same friends that you started with. Probably won't end with them same friends. It probably won't end up that way, and that's just something that you're gonna have to deal with. That just comes with the territory, and you have to have some tough skin.
Yeah, that's why I was always the opposite. I never wanted to move up. I was content going to work, doing my job, and going home. I'm still very content. That's still the ideal goal. But then, it just kind of sometimes just naturally happens.
Yeah.
Where even though you didn't really want to, just like seniority or whatever the case may be, sometimes, it just happens, and then you get in these positions, and then you quickly learn that.
It seems like that's kind of how it happened for me. Like, I wouldn't just go into it like, yeah, I'm gonna end up a charge nurse, or I'm gonna end up doing this or that, and it would just like be a natural transition, and just happen that way. Let's see what's next. How would you say that nursing changed you in your first year?
It's changed me as a person. I am a professional people watcher now, which sounds really
Oh my
creepy,
God,
but I am.
yes. Staring at people's
Don't let
veins.
I was just gonna say, don't let me stand in the grocery store line and have somebody with big old popping veins, and I'm just like,
and you're looking at their ankles and feet, and you're like, ooh, they got CHF.
Yeah. So that's definitely changed me as a person. And I laugh. All of my friends, instead of going to an actual doctor, they come and go, hey, what is this? I'm like, please go to a doctor.
Yes.
So stop bragging me.
Yes.
I'm not on the payroll.
I'm off duty.
Like that. I'm off. I say that every time I have a drink of alcohol. They were making fun of me yesterday, actually, because it was on video. Be like, hey, I'm drinking, or I haven't had alcohol. You're waiting for the ambulance like everybody else. So don't do something stupid just because I'm here.
For real. No, for real. So yeah, I would say it definitely made me a people watcher. And I feel like nursing can make you jaded, but I purposely go, and I can say it kind of made me that way in the first year, but I purposely try and go out of my way not to be that nurse. Like, I'm not going to be the nurse that whenever I see a nursing student, I'm running because I don't want anything to do with them. Or like, if I don't want to precept somebody, then I'm going to make their life hell because I was voluntold to do this. Now I'm treating them like crap. Because a lot of nurses end up doing that, and the nurse eat their young mentality, like we have to kill that. We have to be the ones, the seasoned nurses have to be the ones to kill that narrative.
That is a pet peeve of mine. I can't stand that. When I don't think in nursing school I only had that experience once. But I think it had a lot to do with that I worked at the hospital. We did most of our clinicals on, so I knew most of the people already, so they were a little bit more open, I think. But that happened. I forgot which rotation we were on, and I was like, absolutely not. Like, why? I don't understand. And then I've always made a very conscious effort. Like when come on, follow me, let's do this. I try because I feel like nursing students were so worried about messing up or asking stupid questions, and they're gonna blah, blah, blah. And when you're a nursing student too on clinicals, it's a walking job interview.
Literally.
So that was another thing. And because we all got hired from our clinicals that I know. There was 4 of us in our graduating class that got hired from ICU from when we were doing our clinicals. So I've always tried my absolute best to change that whole direction of nurses eating young, because I never understood that to begin with.
Yes. I try to make sure to tell new nurses that it is your right to advocate for yourself. And if someone's treating you badly, you go tell the charge nurse, or if you're a student, go tell your instructor so they can put you with someone else. Or if you're a new nurse with a preceptor that is not teaching you anything, she's being mean to you, not trying to show you anything, go to the charge nurse, get paired with somebody else. Because at the end of the day, this is your opportunity for learning. And if you're not learning anything, then it's on you to speak up. And you don't want to be thrown on the floor, your orientation's over because you didn't say anything and they're expecting you to kind of know a little bit at least to get through until you start, building up more and more confidence. But now you're on the floor by yourself and you don't know anything because the preceptor didn't teach you anything, but you didn't say anything. So you have to speak up. You have to speak up for yourself. What would you say helped you survive mentally?
My cohort, actually. I would say the friends that I've made that I started off with, and a lot of them I went to nursing school with, I feel like we created a bond with each other that we could just go and just let our frustrations out. And hey, every unit I feel has the certified cry closet. Where you go and you hide in the closet and cry. We've all been there.
Yeah.
I think I was in there a lot. But I would come out after work, and we'd just be talking, and then just really confiding in people who understand what you're going through, I think really helped that.
Yes. I did make friends from work that I'm still friends with to this day, even though I'm not there. We go do stuff sometimes, brunch, vacation, whatever it is. I would say I think what helped me survive mentally was I would take PTO as much as I could. any kind of PTO that I had built up, I was taking it. Or I would try and bunch my days to where I'd be working the front of this week and then the back end of this week. So I'd have all these days off in between, because even if I'm not doing anything and I'm not going anywhere, I need the mental health days. I need them days where I'm to myself, not doing anything and not at work. So that's what helped me survive.
I do miss that part about.
Yes.
That's one thing I miss about being on a Monday through Friday. I really enjoy my Monday through Friday, but I miss being able to self-schedule things.
Absolutely.
So I have to work 6 days in a row and then have 2 weeks off. And I miss that part. But.
Yeah, that's the benefit of working 312s. But yeah, I'm working Monday through Friday also, because my kids run my life, and it's more beneficial to their schedule for me to work Monday through Friday. So that's what I'm doing until this life insurance thing takes off and I'm a millionaire. Then I could just work when I want to. But until then, I'm working Monday.
I want to keep my skills up.
Right.
For survival.
Until then, I'm working Monday through Friday. Okay, we are at rapid fire advice. So, advice you wish you followed sooner.
Slow down.
Advice. Oh, slow down. Okay.
Yeah, that was advice that I got. Don't try and do too much. Slow down. And I was like, what you talking about? And I was just going. And then I wish I would have slowed down. Slow down some.
I would say What advice I wish I had known sooner? You're not slow. You're not incompetent. You're just new. You're going to eventually get to a point where it's like what you're doing is just second nature. Like you're going to automatically jump and know what you're supposed to do. But that takes time, and you're not going to know that at first. I would say you probably won't even know that in the first like 6 months to a year. Like it's going to take some time and some repetition and some doing stuff over and over again before you feel like you know what you're doing. One thing every new nurse needs to hear.
I feel like new nurses specifically need to hear what they're doing good, what they're doing well at, opposed to always saying where the improvement needs to be.
Mm-hmm.
Because when you hear, oh, well, we need to improve in X, Y, and Z, that really starts to kind of weigh on you. I mean, it's important to know where your improvement should be had, but at the same time, I feel like your strengths should also be highlighted. So you know what you're doing good at.
For sure. I'd say every new nurse needs to hear advocate. Advocate, advocate, advocate. Advocate for yourself. Stand up for yourself. Don't let anybody bully you. If you feel like something is unsafe, speak up. And also advocate for your patient. So, like I just said, if you feel like something's unsafe, speak up. If you feel like the doctor needs to know something, or you want the doctor to maybe give the patient something, like you're there with the patient for 12 hours and they come in for 12 minutes and they don't really know what's going on. Like they know, but they don't know. Like you know, because you're there all day. So if you see them, they have like Tylenol, PRN, but you see they're in so much pain and they don't have anything else, advocate for your patient. Call and say, hey, this patient is feeling like such and such. Can I give them this? Can you order this? Which is part of the reason why I created in my new Grad Nurse 101 bundle. You get everything I wish I knew for one, but you also get a principal handoff shift report sheet where you shouldn't leave anything out when you're getting reports, so you know exactly what you need to know about this patient. You're not leaving anything out that you need to know, and also you're getting a printable S-bar template so you can feel confident calling the doctor, because that's another thing new nurses are a lot of times scared to do, is talk to the doctor, because we can get intimidated. But you know what you need to be saying to the doctor. Get to the point. This is what is going on. This is what I need. So you can get what you need for the patient and advocate for them. Okay.
Very true topic. That was really hard for me as a new grad.
Talking to the doctors.
Giving reports in a structured format, so where I'm not blabbling everywhere.
Yes.
And then thankfully we ended up closing the ICU, so we had intensivist there. But if I say, hey, I had to walk up to them and say, hey, this is what I'm needing, or X, Y, and Z, getting my words together exactly what I'm needing and why, because they'll rapid fire questions at you, and you're just like, and they're like, what do you mean you don't know that? And I'm like, looking like you're in the headlights. So that getting all of my stuff together before I go and talk to the doctor was very
key, for sure.
Yeah.
Okay. What kept you from quitting during your hardest moments?
My kids needing to eat.
Man, what?
My kids.
For real. No.
I don't have rich parents, but I have rich kids. So having them needing to eat 3 times a day kept me going, honestly. And then I knew, like, the hard days I knew were hard days, and it's not every day. And I worked so hard to get where I was at, and I'm stubborn on top of that. So we powered through, and then I had to really learn to give myself grace, especially in the learning periods. And then I could be in my feelings for a little bit, but then we dry up the tears and we keep it pushing, and we learn what we did wrong or what we could do better next time, so it doesn't happen again. So I always kind of thought of it as a learning experience over a trying. You know what I mean? Like, I just really try to learn from each busy day or bad day or whatever.
Literally, same. That is what kept me from quitting. What kept me from quitting was my why. Like, I wanted to quit a lot. Like, I wanted to quit so many times. I'd have a stressful shift and then have to go back the next night. And then I'm like, oh my God, I got to do this all over again. But yeah, my kids got to eat. I need this job. I need these benefits. So let me just head down, clock in, do what I got to do, clock out. 12 hours. It's a bad shift. It's not a bad life. It's not going to stay the same forever. Plus, like I said earlier, nursing, there's so many different avenues that you can do. So if I'm miserable where I'm at, I'm like, okay, let me do my 6 months and I'm getting out of here. Head down, head down, clock in, do what I gotta do, clock out. 6 months, I'm counting down the months, and then I'm moving on because you don't have to stay stuck anywhere. That's the benefit of nursing. You don't have to stay stuck anywhere if you don't want to be there.
But usually by the 6-month mark too, you start to get more comfortable. You start to understand, unless it's just a culture in the unit. Sometimes it's just purely the culture of the unit that makes it awful.
Absolutely.
But if it's more, that makes a huge difference. But a lot of times, that's another thing I always tell myself. If I go in and I'm either overwhelmed and like when I came to what I'm doing now, the clinic was completely different, and I was completely overwhelmed. I never did oncology before. I had no idea about oncology, and the doctor they gave me was neuroendocrine oncology on top of that, which is a whole different ballgame. So I was drowning, and I remember telling myself, "I'm going to give this 6 months. Give myself 6 months. If I'm still not feeling it at 6 months, then we'll go into back to something different." But thankfully I did. I waited all that time. I waited 6 months, and now, I'm very comfortable with where I'm at. It just took that learning, that time to be comfortable with it.
And oncology is one of those specialties apparently is like high demand because this strike that's going on, oncology is one of those specialties that's like getting more money than most other specialties right now. It's like NICU, PICU, and oncology.
Yeah.
It's like,
Yeah, it's growing so much with the research and just the patient load specifically is like we're getting more and more patients, if you like younger patients at that.
Yeah.
And that's kind of a trend that we're seeing. I work in GI, and what used to be we call like rectal cancer, we used to call old man syndrome, or because you used to be like 65 plus, you wouldn't see it. Now we're getting people in their 30s, 20s, 30s, 40s with these things, and we're seeing younger patients and higher acuity patients, and the demand is growing.
Yeah. Well, thank you, Stephanie, so much for being part of this conversation. I feel like this was so. Did my screen go out?
I see you.
Oh, it's just telling me my live is gonna end in 5 minutes. That's fine. Okay, TikTok. We was ending anyways. But I feel like this conversation is so valuable. I feel like any new nurse or nursing student would get so much out of this. Like, I wish that I had something like this to watch when I was in school or when I was a new nurse, because I would have been like, hey, I need more. When are y'all doing this again? So, and plus I had another nurse that I went to school reach out to me, and she's like, hey, I work in the ER. Let's talk about that too. So I'm like, okay, we're going to make this like a series or something. So
yeah, that's great. It's great to have different perspectives.
Yeah.
Each department is so different.
Very, very. So I appreciate you. Any final words for the new grads?
Y'all got this. It's a hard career at the beginning specifically, but you can do it. Keep up with it. Be an open mind and advocate for your patients. I know we said that a lot, but it's so true. And that's why we're here to begin with. So y'all got it.
Absolutely. And final words from me. If you're in your first year and you feel overwhelmed, you're not behind. TikTok, stop sending me this message. You're right on time. Growth is uncomfortable, but you don't have to do it alone. So you have people like me that you can reach out to. You have resources that you can access. Go to the link in my bio, look and see what is something that you feel like would benefit you. You can also book a call with me. So it's up to you, but the resources are there. And I also have a free nursing community. So just click in the link in my bio, join the community. It's free. But anyway, thank you for being here. Thank you for trusting us. Thank you for being part of this conversation. Make sure you stay connected. Follow me, Nurse Bay Coach. Follow Stephanie. And that's it. I'll let you know next time we do this. All right, bye, girl.